My name is Julie Cameron, and I'm the Associate Director within the Mental Health Foundation. We are an organisation who is focused on the prevention of mental health problems. And that means that we try and work to ensure that people have the best conditions to enable them to thrive in their lives. So that involves working with policy, working in research, and also doing more programmatic work to ensure that we best understand the relationship between mental health and different things in people's lives. And also, as I say, so that we can really let people know what will help to improve their mental health or to prevent mental health problems starting in the first place.
What are the key contribution factors to good mental health?
There's lots of things that can help ensure that your mental health is as good as it can possibly be. And this includes things like having good, strong social connections around you. So you've got people that you can talk to. If you do start to feel sad or unsure about something that's having an impact on your life in a negative way. And we have within the Mental Health Foundation top tips for people that we have kind of worked through research and got the views of people who themselves have their own mental health problems or perhaps those that don't, to say, what do you think would help to keep you as mentally healthy as you can be? So this includes things like getting close to nature and making time for getting close to nature, as well as the things that we may not understand and that we hear about more frequently, like getting good sleep, eating healthily, and trying to kind of keep moving and be active. And there's a few other things too, but I think they're the really important things, having kind of social connections, but also looking after your body so that because there's such a clear link between your body and mind. We work across the UK, so we have offices in Glasgow, London, Cardiff, and Belfast. And we do a number of different things to try and prevent mental health. We work at a policy level because we're very aware that in order to create those kind of best conditions for people's mental health, that lots of factors influence your mental health that as an individual you don't always have control of. So that's, for instance, like your access to education, to healthcare, the circumstances within which you're born, um, whether your family live in poverty or not. So these are things that really the government have quite a lot of influence over. So we do policy work. We also do research to help inform the different campaigns and the different work that we do. So every year, for instance, we run the Mental Health Awareness Week, where we have a particular theme, and that really helps to raise public awareness of things they can do to improve and support their own mental health and those in the lives around them. We do things like programmatic work, which is at a much more community-based level. And within our programmatic work, we tend to focus on 4 different priority groups, and that includes refugees and asylum seekers, people with long-term health conditions, young people who are more marginalised, and then wider families, particularly parents those who parent alone. So there are priority groups, and as I say, we do that at a community level and then work at kind of wider organisational or government level to try and create change that's needed. We think it's really important to talk about mental health, not only because that means that you will be getting support from others, but also, as you said there, it starts to challenge the stigma that continues to surround mental health. And it's important to say that we have made great inroads over the last number of years to ensure that people do feel more confident and more comfortable talking about mental health, but stigma still exists, and particularly in different settings. So we know, for instance, that there continues to be stigma for employees in terms of letting their workplace know if they're experiencing mental health problems. So by talking about mental health as a society, we are creating the right conditions so that people feel more freely to be able to access support, and that's what's really important. There might be people for whom are experiencing mental health problems, or even those who might have a diagnosis. They can now some diagnosis around their anxiety or around depression, for whom actually there's no real outward signs, that they keep that quite closed. And that's the challenge with mental health. It's not, that's now quite often where it's quite different from some physical health conditions where people might be able to very much readily see what's wrong. Of course, if you know someone, you might be able to notice some changes in their behaviour if you know them well, or if it's a colleague. and that could be an indication that they're experiencing now some mental health problems. But I think it's really important to say that there's no one list. There's not one list that would say, here's the signs and symptoms. It's about you knowing a person and perhaps starting to see a change in them. And that might be enough for you to say, look, are you okay? Are things all right? And hopefully that would open conversation. So mental health is tricky in that sense, and that there's not always outward signs that people are struggling. Again, when we're talking about mental health, I think it's really important to know that there's different levels of how people are managing their mental health. So we try to describe this as two kind of now you can have mental illness, but also that your well-being, and both of them kind of run alongside one another. So for instance, you can have a person who has a mental health diagnosis for now whatever that may be, whether that's depression or whether that's a more complex and enduring mental health condition like psychosis. But actually, if that person is managing that, seeking support, perhaps on medication, they can be living well and their well-being could be quite decent now, quite good. But of course, you could also have a person for whom they've got an awful lot of stress going on in their life. They're starting to feel very anxious, but they don't necessarily have a diagnosis of a mental health problem or a mental health condition. So they actually have very low well-being. And it's about these two things running alongside one another. If an individual starts to think that they're feeling overwhelmed by life and things that are going on in their life to a point where it's really influencing and impacting what they do and what they feel they can cope with, then we would absolutely recommend that they reach out and talk to someone about that. And that includes going to your GP. In the UK, your GP can really be the first place to go to enable you to access more specialist support if that's something that you need. So if you're starting to feel overwhelmed and to feel that now that you're really not coping with life and with different stresses that you may be experiencing, or you're noticing unusual experiences that you think are out with what you would now that are frightening you and making you feel worried, then go to your GP and have that open and honest discussion with them. And then they can hook you into the more specialist mental health supports that you may require.
What tools or resources are available to support and protect your mental health?
Yeah, so this is the good news. There are loads of tools and resources out there that can help people. So I mentioned before that we have within the Mental Health Foundation, people can go onto our website, which is www.mentalhealth.org.uk. And there is a whole host of resources that people can access that gives great tips on how you can look after your mental health and how you can encourage others in your life if you're worried about them to look after their mental health. And all of these things really matter and are evidence informed. That includes things like getting out into nature, being kind to yourself, and kind of making sure that you've got, or that if you haven't, that you can try to connect into your community, maybe by volunteering or kind of going along to local clubs so that you feel more supports within your life if you are feeling lonely or isolated. One of the biggest issues that are impacting on people's mental health at the minute is debt and financial worries with the life and the circumstances that we have in this country at the moment. So there's lots of advice out there around managing your debt and kind of getting on top of your finances. And again, if you go to our website, then people can certainly, there's specific leaflets and there's information on there. But there's also lots of other organisations, local organisations that people can go to for support and help around how to look after their mental health. And there's also things, quite specific things. So for instance, if people are struggling with sleep, we know that can really impact on their mental health and lead to a kind of deterioration overall in their life, their quality of life. And these days, of course, people can access free apps to help them around that. And there's lots of kind of well-being apps that people can access that they might find helpful, and some of them are free. So I would really encourage people to look about, but also to go to some trusted sources like the Mental Health Foundation's website and other organisations like Mind or things like that. So lots of organisations out there, you can really impact on your mental health through different lifestyle choices. Having supports around you is probably one of the most protective factors that you can have to support your mental health and to enable you to thrive as a person. That includes having good family connections and good friends around you, and also just having things in your life that are interesting to you, that you enjoy doing. And that goes right across piece. One of our top tips actually is about kind of planning things into your week, months that you look forward to. And that's because that gives us hope. And that's also what comes from having good supports in your life, whatever form that takes. So being vocal and having people around you where you can be open and talk honestly about how you're feeling is incredibly important. Because if you're just bottling up your feelings, invariably what happens is that it can increase your sense of isolation, and just that now you're having to deal with things alone. Whereas if you voice and open up about your mental health to people, and whichever form that takes, whether it's family, whether it's friends, whether it's at a local community centre, whoever it is, then you can start to feel that you're less alone. And that has a huge impact on people's mental health in terms of feeling that actually they can cope with those feelings of anxiety or shame or whatever it is that they're going through. So it's incredibly important. Particularly for people with disability, we know that there is a really strong relationship between people who have a kind of long-term health condition or disability and your mental health, because of course your mind and body are so linked. And particularly if you're living with pain or you're living in circumstances that restrict what you can do, that can have a huge impact on your mental health. So first thing is just knowing that that's the case, and then being able to perhaps reach out to others who might be in similar situations. So for instance, at the minute we work with a number of long-term health condition organisations to help them be able to draw in more conversations around mental health when they run their peer support groups or their self-management groups. So there's lots of these kind of groups at a local level that people can tie into, that they'll be able to come along and meet others who are in similar circumstances to them. Maybe that's because they have, as I say, a similar disability or long-term health condition, or that also applies for ethnic group. If people feel that actually that they would feel much more comfortable going along to, for instance, a women's group of a particular ethnicity, because that would enable them to be more open, then there are local community groups that they can attend and tap into. And sometimes that can be a huge boost to your mental health. There's a number of different things that influence our mental health. So we would describe them as social issues, economic issues, as well as biomedicals, which might be the kind of hereditary things that we have within our lives. And all can have quite a strong influence, particularly those social and economic factors. So one of the things that we know for absolutely sure is that poverty has a huge influence on mental health. And that's in both directions. So if you live in poverty, you're more likely to have, more people are more likely to have poor mental health. But also if you have a long-term and enduring mental health condition, you're more likely to live in poverty. So it goes in both directions. So that's why, of course, we work at a policy level to try and ensure things like that, to influence government, so that if people perhaps are on benefits, that they have enough money coming into their household to be able to live and to be able to feed their children and do all the things that as a human race we should be able to enable people to do. So we know that things like that have a huge impact on your mental health. We also know that your life circumstances, whether you've experienced trauma and something now distressing in your life, can have an impact on your mental health and your ability to cope with those feelings that may arise from that. But we also know that your access to education, if people are able to access education, that can have a real benefit to their mental health. So the opposite is true. If you're not encouraged to go to school, or for whatever reason that you don't take that further, then that can have an impact on your mental health. Workplace has a huge impact on people's mental health in terms of it being both positively or negatively. So lots of things that influence your mental health, and some of those things you can be in control of, and some of the things, as I say, organisations like our own kind of lobby government to try and ensure that as a society, the government is taking responsibility to ensure that people have as much as a good start as they possibly can to ensure that their mental health has a chance to flourish. And every year, as I say, for Mental Health Awareness Week, we run a big campaign and we do some survey work across the UK. And this is getting the opinion of kind of thousands of people across the UK to understand what influences their mental health. And for those that we surveyed, of the 35 to 64-year-olds, financial worries came out as the absolute top for influencing and making them feel anxious. So we know this last year and years before that, that money worries have been top of the list, if you like, in terms of what people are feeling anxious about. So this is always a challenge. I think there's things that people can do individually. Now, debt doesn't go away. You do have to face it. And I think there can be quite often very complicated feelings attached to feeling out of control around your finances. You can feel shame, for instance, if you don't feel that you're providing for your family in a way that you would like to. You can feel embarrassed if you lose a job, and perhaps now there's a whole host of complicated feelings. So what we would encourage people to do is say, look, actually try and get some sound financial advice to help you manage any money worries that you may have or debt concerns that you may have, because by not facing up to them, they're not going to go away. They're just going to get worse and feel more and more overwhelming. And as I say, there's some great places that people can go. Our own website has links to some of these places. Now there's quite famous people like Martin Lewis who give really great advice around where people can go around accessing support for their finances. So that's the first thing, just to recognise you're not alone if you're worrying about your finances, and there are places that you can go to try and get some support in managing them. And I guess the other thing to do is just to be, to kind of perhaps being able to kind of do things that take you away from those worries sometimes. Now, sometimes if that's all that's on your mind, that can be incredibly overwhelming. So that's where things like the connection to nature or doing mindfulness, so that you can just take some time out and take a breath, can be really, really helpful for people. The main things that I would say to people are, look, understand your own life and where those stresses are coming from. So now, if you know we're kind of the certain circumstances that are arising for you, or perhaps not, maybe it's just everything feels overwhelming. There are some things that you can do just to kind of say, well, hold on, wait a wee minute, I need to kind of make some sense of this. And some of them are well known, and I know that people can perhaps roll their eyes about this advice, but it has really been proven to be the case that if you do exercise, if you get out in nature, if you look after your sleep, that will really help your ability to feel that you can cope with some of the wider stresses that quite often are out with our control, like money worries, So being able to do things like exercise, like just take some time for yourself sometimes to be able to just de-stress and decompress can really help. But the other things I think that are really important are those ones that all come under the kind of having good people around you and having social supports. That is so important for people to not feel alone. And as I say, there's so many great things going on in our local communities, but sometimes it can't not always feel like that. So really trying to connect in and find out what's available to you locally, whether there are things that perhaps you can go and volunteer at so that you can meet new people locally and to get involved in things. And I guess encouraging yourself to be open to new experiences, because that sometimes we get into a way of thinking that can be quite negative about, people can be their worst and harshest critic. That's quite often what you can find, where you say, well, I'm maybe useless, I'm no good at that, so I'm not going to do it. But by having people around you who can challenge those points of view and say, do you know what, you're not those things, I think you're dead kind, I think you're really loving to me, it can just challenge those negative thoughts, which might be enough for you to really to take a path of accessing support, or to do things just for yourself and not thinking that you're selfish in doing that. The main thing for us is our website, which is www.mentalhealth.org.uk. Twitter, you can follow us just at mentalhealth. So that's how you can access the Twitter feed is at Mental Health. And we're also on things like Instagram, so people can get us there on Instagram, which is, again, you can just type in Mental Health Foundation and you'll be able to see us on that. So the main thing is www.mentalhealth.org.uk, and you'll see all of our resources. And that includes a number of courses that we've got available now called Future Learn, that people can, that are actually just at a small cost. But you'll be able to get all the details on that if you go to www.mentalhealth.org.uk/workplace-wellbeing, and that's for a specific course around looking after yourself and work. But as I say, there's lots of free resources on our website, so do just go there.